Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson. We're talking today about home-based care. We talked first with Christine Caffrey about home health, and we're going to talk next with Stephanie Launey, palliative care nurse practitioner, about an area of home care called palliative care. Stephanie, welcome to the program.
Nice to be here.
Thanks so much for coming in. Now, I think people are pretty familiar with home health, and we learned some interesting things about our own home health this morning that are unusual and special, which is really neat. And I think people kind of know the term hospice, even if they don't know a whole lot about it. But there's this place in between called palliative care that I think a lot of people don't understand. And so if you can, just start off with, what is palliative care?
So palliative care is an extra layer of support for patients and their families. They may not be quite ready for hospice. They have a chronic illness that they've been dealing with for years. They have a cancer that they're having burdensome symptoms. They are ready to have difficult conversations. We're there to support the family and the patient as they go through all of that.
It's interesting to think about how people qualify for each of these different types of home-based care. And we talked a little bit about how people can qualify for home health. Tell us a little bit about how people qualify for palliative care, because that's different.
Yes, so usually a patient can be referred by a doctor to our clinic, or we see them in the hospital. Usually they have a chronic illness, say heart failure, and they've reached a point where they need extra support. They're having a lot of shortness of breath at home, and we're there to kind of help manage those symptoms and help talk about their goals. And we look at the bigger picture. We look at the whole person and trying to make sure they have a good quality of life as they're dealing with those chronic illnesses. So anyone with a chronic illness such as COPD or heart failure or cancer, and they need some extra support and extra symptom management, they usually see us in the clinic for.
Okay, so that may be home-based, or it may be in the palliative clinic with an appointment.
Exactly.
And would you say that palliative care is always triggered by a hospital experience?
It can be, but it's not always. We do see a lot of initial patients in the hospital, but a lot of times an oncologist or a pulmonologist will refer their patients to us for extra symptom management or just extra support.
Okay, so it may not be in the case, as we were talking with Christine earlier, a lot of times home health comes through a hospital stay or a rehabilitation facility or a skilled nursing facility, something like that, although it may be a doctor who's prescribing home health. But from a palliative standpoint, in many cases, it may or may not be driven by a hospital stay.
Right.
You may have someone, like you said, who has COPD, which of course chronic obstructive pulmonary disease, and so someone with a long-term lung disease. Mm-hmm. And you mentioned CHF, congestive heart failure. Someone who has cancer and maybe a terminal diagnosis of cancer. Mm-hmm. So in those situations, that specialist that they are seeing on a routine basis for their illness may suggest that palliative care would be a helpful part of their care.
Right.
Okay. So similarly to home health, I'm thinking about if my family member has this diagnosis, is under this care, and the doctor has said, you know, I really would like for you to talk with the palliative care team to understand what they may be able to help you with at home or in their clinic. Mm-hmm. Is that patient going to be able to use their insurance, or how is palliative care paid for?
So we accept all insurances, and we kind of cover out-of-pocket cost because we try to make it about quality of life, and so we accept all insurances, and all insurances usually cover palliative care. So it's like another specialist that you're seeing.
Okay. So you wouldn't have a worry that this was something you were going to have to come out of pocket or come up with a way to pay for. And it may be in the home, and it may be also in the palliative clinic, or some combination of those two. Mm-hmm. But talk a little bit about the types of care. So from a nursing standpoint or therapy, what kind of care?
So in the home, we would see the patient about once a month, sometimes every 2 weeks if they really need extra help with their symptoms. We have a social worker to help evaluate the home and see what other services they might need. And we just take a look and see what they need at home as far as do they need any like equipment at home. We can kind of help assess that. any kind of extra medications to help with their breathing or their pain at home.
Okay.
So.
And then in the clinic, is it similar or a different situation?
So in the clinic is pretty similar. So we usually assess the symptoms that they have, and that's our main focus. And we also refer out a lot to other services like psychologists or psychiatrists if needed. And we have a lot of extra therapies in the community, like music therapy and things like that we can refer people to.
That's pretty fascinating. So let's talk about that for a minute, because I think, you know, we were talking in the first segment about home health. We're very focused on the health and well-being of the physical body, although certainly social work is a component. But it's generally transitional after something has happened and getting that person back to their level of activity and health. Palliative care is more a recognition of how do we create the most comfortable quality of life for someone who is faced with a long-term terminal illness. And so there are aspects of it that are physical health, but there are significant aspects that are social, emotional, mental health.
Right.
And we have a music therapist at St. Tammany Health System, and so she is a big part of palliative care?
Yeah, we like to use her when possible. So.
Can you talk a little bit about how that works? Is that maybe the social worker determining that that's a good idea, or does music therapy pretty much always have a role at palliative care?
So we kind of feel the patient out. We ask the patient if they would be interested, and from there we kind of refer, because not everyone is interested. But if it is something, I've heard good things that have happened with just patients who can't communicate necessarily, but are able to play musical instruments and interact with the family that way. So it kind of helps with the families too as well.
That's fantastic. And I think singing can have a component with speech therapy. So when they're trying to work with a patient on their speech and the functioning of the throat and mouth and all of those things, because it's not just speech, it's all of that function, that music therapy can have a component there.
Right. So it's really helpful in a lot of our patients. And it's looking at the bigger picture. So helping the patient live the best life they can with their illness.
Helping the patient live the best life they can with their illness. I really like that. And I think if we were going to try to sum up palliative care, that really would be it. Because you have all of the health care opportunities of home health. You have nursing care, you have therapy care, and you have that social, emotional, and mental component. But you also have the ability to look at, okay, we are dealing with a patient who is faced with a terminal illness. They may have a long time to live with that illness, and how do we make the most out of the time they have left here?
Exactly.
That is really admirable, and I think more people would benefit from palliative care. So hopefully we've done some good things today educating about what palliative care is.
Yes.
Well, thank you so much for coming in. It's been a blessing to have you.
Thank you so much.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about home-based care. We learned about home health care from Christine Caffrey, and Stephanie Launey taught us about palliative care. Next, we'll hear from Jean Gobert, who will teach us about hospice care. We'll be right back.